Hi everybody, my name's Simone Walker and I'm one of the Deputy Secretaries here at the Department of Communities and Justice.
And I'm Joanna Quilty, CEO of the New South Wales Council of Social Service. I just might start by saying that it's great that such huge progress was made last week in getting rough sleepers into extended accommodation and providing training and guidelines for SHS services to keep clients and staff safe. So Simone, I just want to say well done to you, the DCJ team, and also to the Minister, the Minister's Office, and I think Homelessness New South Wales for really fantastic work. And I think it just shows, how extraordinary we can be when there's collaboration.
Thanks, Joanna. I think that's absolutely true, and all credit to my DCJ colleagues, but also the funded service providers who have absolutely worked hand in hand with us on that work. There's some amazing early successes, and we think that will really help in our approach to COVID-19 and provide great health and safety for people who have been sleeping rough.
So to this week's questions, and the first one concerns, I think, increased risks that we're seeing the crisis create for already vulnerable children and young people. So Simone, a number of services are really concerned as to whether there can be guarantees provided that young people won't be transitioned from out-of-home care and that their placements can be extended, and they're seeking some written confirmation on that.
Thanks, Joanna. We're looking at a number of strategies in this space to make sure that we're exercising our legislative authority to look after young people leaving out-of-home care, because we have the power to do that up until the age of 25. But what we know is that when young people leaving care feel vulnerable and not secure in their ongoing housing, that many of these issues actually existed before the virus was really something that controlled a lot of our lives. There actually is already access to youth subsidies that we can provide young people leaving care. And we can also help, and good casework will help young people negotiate staying on in placements with their carers. So there's a couple of options that we're looking at, and we'll provide absolute written advice.
Thanks, Simone. So the next question relates to unaccompanied young people turning up at specialist homelessness services and needing to self-isolate. Temporary accommodation is a fantastic option over an extended period for adults, but it's not going to be appropriate for these young people. So what should services be doing in these situations?
So DCJ is working really closely with the homelessness peaks, and this is one of the issues that has come up for us. In a way, the accommodation itself becomes the part that is easier to solve. While we're looking at temporary accommodation, we're also looking at a number of service departments and not just single room hotels. One of the biggest challenges for services will be about being able to support young people with staff during that time, and that's the additional conversations that we're having at the moment.
So we also know that for women who are in lockdown, stuck at home, that they can be exposed to increasing violence. What are DV support services supposed to do where there are children who are impacted by the violence and exposed to that risk? What are the options that they should be considering?
I think we've been really impressed already with the ability of DV services to pivot their service system really to a phone-based one, that it has already shown great effect. But we know that there is deep concern that on the phone you may not be able to know and understand the actual experience for a woman in a violent household. Where we think a child's at risk, certainly immediate risks, people should follow all the procedures. If that's calling police, if there's an immediate risk, or if there's a child at risk of significant harm, calling the Child Protection Helpline. The main thing I want to reassure people is if there is a child at risk of significant harm, DCJ, child protection caseworkers, are absolutely doing face-to-face visits, and that we will ensure that children in these circumstances receive the support and help that they require.
And a program like Staying Home, Leaving Violence is still an option, isn't it?
Absolutely. Staying home, leaving violence is a great option because it means that women are stable in their accommodation, that kids are stable in their environment, especially in a time where some of the school, for example, one of the greatest pieces of stability is not an option for many children. We also have facilities for perpetrators to be accommodated. If they can't and don't have the means to accommodate themselves, then we can arrange that, because we actually think that that's a better investment for women and children to stay in their home. And that's the circumstances that we've already addressed and been able to provide accommodation for perpetrators in those circumstances.
So Simone, we are seeing emerging gaps where different parts of the service system need to talk to each other and coordinate, but that isn't always necessarily happening. For instance, people leaving prison who need to connect with the health system in order to qualify for housing, but are facing numerous challenges in that. Women exiting rehab services where they've got child protection issues as well, not necessarily getting consistent support from DCJ across different districts, or even kids who have disengaged from the education system and DCJ not necessarily being in the loop on that. I'm just wondering, what is the overarching mechanism to ensure that there is this coordinated whole of government approach, that these kind of interface issues are being addressed, and that people aren't falling through the gaps?
I think this is a really understandable concern. People need to know that government agencies are working with each other. The heads of agencies meet multiple times each week to keep that coordination going. Inside my part of the department, we've established the Vulnerable Priority Cohort Strategy Group. That's been headed up by Gary Groves. Many of you will know him from Their Futures Matter. And this is really an opportunity to provide a clearinghouse for these issues. We're in daily conversation, particularly with education, around our vulnerable cohorts of kids, and working out particularly about what Term 2 looks like and how we can keep eyes on children and ensure their wellbeing. The other groups that it's important for people to know about is the fact that every agency has representatives at the State Emergency Operations Centre based at Homebush, and this is a really great opportunity to get in early where there are issues that are raised, where there are disconnections, so that we can fix them.
There seems to me to be a need for an overarching plan to ensure that we do have a robust and effective service system that's appropriately skilled and resourced to respond to both the short-term challenges, but what they are going to play out to be over the longer term. And I'm wondering, how do we go about developing that plan?
I think there's a whole range of things that we've already learned that we would want to take forward into a service system. Getting the time and space to think about that plan right at the moment is challenging, but I think we are collecting data and looking at different opportunities, even some of the feedback from the sector about different referral pathways that people are coming into the service system through really challenges our ideas about what a traditional service system looks like. I think the close collaboration that we've had, firstly between ourselves and the peaks, but also ourselves and the service providers, is something that I really want to retain, and that will be the source of the conversation about what this looks like going forward. There's two other things I just wanted to mention is at the request of the sector, we did follow up about access for EAP services for the sector. That's now in place, and we'll be putting out some information really shortly about how people access that. And the other request that I would make is that our NGO partners update their details on HSNet. HSNet is being used widely by Service New South Wales to be able to connect people in need to services. The data gets used by a range of agencies and also by people looking for support for themselves. So they're just two things that I just wanted to mention. But again, it's been a great opportunity for us to discuss and talk, and I look forward to the next time. Thanks.